Hello, everyone. Welcome to our panel discussion titled A True Safety Net or Hanging On by a Thread, a discussion that will focus on the US social safety net, including programs like unemployment insurance, TANF, SNAP, and Medicaid, the effectiveness of the safety net in helping lift families out of poverty, how the safety net, along with some new pandemic programs that were administered during COVID-19, like the economic impact payments or the cash payments, held up during the pandemic, and whether there are ways to reform it. My name is Aparna Mathur, and I'm a senior fellow here at the Musawwar Rahmani Center at the Kennedy School. My interest in this topic stems from my time at the White House Council of Economic Advisors between March 2020 and April 2021. When I joined the CEA, the crisis was at a peak in terms of its health impact, with caseloads and deaths rising, the demand for PPE and other medical equipment growing, and hospitals facing severe capacity constraints. Efforts to control the pandemic were producing major strains on the economy. That is because the rapid spread of the virus could only be contained by locking down businesses, restaurants, retail stores, by closing schools and imposing other restrictions on economic activity. Millions of workers and their families lost most or all of their earnings. The three relief bills in 2020, together worth over $3 trillion, passed by Congress in March and later, provided some assistance to families and businesses, and other relief bills continue to be debated today. Despite the massive size of the spending, we know little about the actual impact of this cash on the economy. Some of this is a consequence of the nature of the pandemic safety net, which was continually subject to uncertainty. For instance, I remember at the CEA, expanded benefits from UI and PPP were available for only short durations, and we had a lot of debate during those months about what the extensions should look like, when the extensions should kick in, and so on. But for several months in the summer and fall of 2020, despite an unemployment rate of over 10%, no relief was forthcoming as Congress could not agree on a deal, with Republicans and Democrats holding widely divergent views on what to do. Some of this was exacerbated also due to election year politics. As a result, the pandemic safety net had giant holes, with relief provided in fits and starts. And some of this debate is continuing today as we figure out which relief programs need to continue and be made permanent, such as the child tax credit, and which ones we need to let go of. The continually changing shape of the pandemic safety net raises at least two questions, one dealing with effectiveness, and the second dealing with targeting. To discuss this, we have three leading academics and policy experts. Their extended bios are online, so I'm not going to go through the whole, the full bios, but I will quickly introduce them. Diane Schonzenbach is the Margaret Walker Alexander Professor at the School of Education and Social Policy at Northwestern University and is Director of the Institute for Poverty Research. She is an economist who studies policies aimed at improving the lives of children in poverty, including education, health, and income support policies. Welcome, Diane. Robert Moffett is the Krieger-Eisenhower Professor of Economics at Johns Hopkins University. Among other work, he has done extensive research on the welfare system, such as the AFDC, food stamp, and Medicaid programs. He has also published research on the labor supply and family structure effects of social insurance programs, including Social Security, unemployment insurance, and disability insurance, as well as the US income tax system. Welcome, Robert. Jason Furman is the Aetna Professor of the Practice of Economic Policy, jointly at Harvard Kennedy School and the Department of Economics at Harvard University. He is also a non-resident senior fellow at the Peterson Institute for International Economics. Jason was a top economic advisor to President Obama, including serving as the 28th chairman of the Council of Economic Advisors from August 2013 to January 2017. Acting as both President Obama's chief economist and a member of the cabinet. Welcome, Jason. So let me turn to Diane, Robert, and then Jason for some initial thoughts, and then we will have a few quick questions from me to open up the discussion, and then we will turn to the audience. Feel free in the meantime to add your questions to the Q&A feature at the bottom of the Zoom screen. So you'll see the Q&A button at the bottom. And James Bien, who is my research assistant at the Kennedy School, will collect all the questions and we will wade into the discussion towards the end, after we've heard from all the three panelists. So let me turn over to you, Diane, first. Thank you.
Thank you so much, Aparna, and great to be here with you all. So I just have a few slides prepared, and I want to start by talking a little bit about what the state of the safety net looked like prior to the pandemic. So what the graph that I'm showing you here shows the patchwork of social safety net programs that we have in the United States. Some are conditioned on work, like the Earned Income Tax Credit. Others are more universal and go to workers and non-workers, like SNAP, formerly known as the food stamp program. There's some that are targeted to families with children, like school lunches or the WIC program. And then some go primarily to the elderly or near elderly, Social Security. What I show here in this graph is the poverty reducing effect of each one of these programs in the pre-pandemic year of 2018. There are 4 different groups that I list, so I know that this is a busy slide, but just bear with me while I sort of walk you through it. The orange is adults without children, and the yellow is the elderly. And then the green and the blue indicates families. The green is adults with children, and then the blue are children themselves. So what you can see by the different heights of the different bars is that different groups are helped by different programs, right? That's part of both the bug, and the feature of our safety net patchwork. By far, Social Security is the largest anti-poverty program. It's on a completely different axis. If we had all of these on the same axis, you couldn't really see anything from the other programs, because Social Security reduces elderly poverty by over 30 percentage points. It is very large. But I'm going to try to convince you that we should be talking a little bit more about children as part of this conversation. So I want to highlight for prime age families with children, those green and blue bars, much of the anti-poverty impact of the social safety net comes from the Earned Income Tax Credit and also the Child Tax Credit prior to our recent expansion of that, and SNAP, formerly known as the food stamp program. Old style welfare, called TANF, right, cash welfare, does relatively little today in terms of anti-poverty impact. And the unemployment insurance system does little during good times, but of course that expands during bad economic times. Just to summarize what the state of the safety net looked like prior to the pandemic was that we have over time put much more emphasis on using the safety net as a wage supplement. The EITC, SNAP, even school meals is increasingly going to children in families that are working. There's relatively little out of work support and very little cash out of work support during normal economic times. And over time, there's been a large push in conditioning more programs toward work. Now, of course, there's some expansion during economic downturns, and some of this happens automatically, and that's good design, right? So the unemployment insurance system, of course, expands automatically as people lose their jobs. So does SNAP, as more families lose their jobs and become income eligible to participate. But because of the many holes in the system, and just frankly, it's not a particularly generous safety net during good times, we probably need to juice these programs, turn up the dial to 11 during widespread economic downturns like we did during COVID. And just to remind you that cash welfare options are just extremely limited. Just to hone in a little bit more on this point about earnings, the following graphs show how much money was spent in 1990 and in 2015 across 5 major programs by whether there were earnings in the household. And these are dollars spent on children. You can see, starting from the left, old style cash welfare, AFDC or TANF, saw a tremendous decline over these 2 time periods. But primarily it still goes to non-workers. The child tax credit was introduced in between these 2 time periods, and the way it's been historically designed is primarily gone to those with or entirely gone to those with earnings. You can see SNAP expanded the amount of spending, but most of that increase has gone again to those with earnings. The Earned Income Tax Credit, of course, by design, only goes to earners, and then Medicaid Also, we've expanded it dramatically, but it has primarily gone to earners. So then if we look at how total spending across all these programs have increased, we've really increased, and I have just noticed that the colors are suddenly reversed on this other, so it should not be that way. And more spending is going to on earners. Now, what does this mean? Well, a safety net that is conditional on work means that you're really in for a double whammy when you lose your job. And again, that's why we need either a redesign of the safety net or some additional money to pour on automatically. Now, I want to also point out that children are more vulnerable during recession. So the graph here shows for every 1 percentage point increase in the unemployment rate, how much does overall hardship increase, and then how much does children's hardship increase. And so on the left, I've got poverty. So for every increase, 1 percentage point increase in the unemployment rate, poverty goes up by about 0.6 of a percentage point, whereas child poverty goes up by a little bit more than 1 point. And then food insecurity has a similar gap. We just have lots of holes for low-income job losers, and that means that it's insufficient insurance. Now, I'll also mention that we've learned from the Great Recession that school spending cuts also harm children. A lot of times recessions trigger school spending cuts because states have balanced budget requirements, et cetera. There's really great work from my colleague at Northwestern, Jackson, along with some co-authors that showed we're able to measure the persistent negative impact on children's test scores, on their college going, et cetera, because of cuts during recessions. Now, of course, policies can ameliorate both of these. This is important because there is a large and growing research literature that indicates that safety net spending on children has strong economic returns. We've got great evidence from SNAP, from the Earned Income Tax Credit, from Medicaid expansions, also from cash transfer programs, that when we spend money on vulnerable children, that pays off in terms of better health, better economic outcomes over the long run. I would argue that I think this also implies that we should be spending more on children through the safety net and other programs, especially children who are at risk of material hardship. In other words, failing to protect children, especially young children, during normal times, but especially during negative economic shocks, it's going to impact them over the life course. So what did we do this time? We spent more relief payments to families. We spent more on relief payments to school. And it's hard right now to predict how much lasting damage we're going to see. I'm at a conference right now where we're spending a lot of time talking about how we should make up for lost ground in education over the last couple of years. So then briefly, how do we respond to COVID? This shows new monthly spending. I recognize I'm a little bit out of my lane, and I'm sure my friend Jason Furman will have more to say about this. But this is the timing of new payments through the safety net and the stimulus payments over time. We can start with the economic impact payments, which are here in green. They were large. We can turn to unemployment insurance. We did a lot to patch the regular holes in UI, expanding eligibility, topping up benefits first by 600 and then by 300, extending duration. And then also we increased SNAP. We let everyone receive the maximum benefit, and we did a 15% across the board increase. Also provided administrative flexibility so states could work on increasing their caseload during the height of the emergency. But we designed that in a way that was relatively poorly targeted within the SNAP population. And then of course, the refundable monthly child tax credit of $250 or $300 a month. There's good emerging evidence that that monthly payment of the child tax credit reduced hardship and poverty. But what this accumulates to is a lot of money spent. And this is a relatively new graph that I'm showing you today, but compares it in inflation-adjusted terms to the Great Recession over the same types of programs. They're on the same scale, so you can see, we spent much less during the Great Recession, much more during COVID, and much less of the money that we spent this time was targeted. Now that said, it substantially reduced poverty and material hardship. This is the decline in poverty rate for children overall. across different programs. Those economic impact payments reduced children's poverty by 4.5 percentage points. And there were particularly strong reductions for Black and Hispanic children. So we bought a lot of poverty relief for this. Perhaps we could have done it at a different price, but I think it's incumbent on all of us to use this moment to better understand the strengths and weaknesses of the normal safety net and try to improve it. Thank you.
Thanks, Diane. That was excellent. Turning over to Robert. I just want to remind everyone, you can put your questions in the Q&A feature at the bottom of the Zoom screen, and we'll collect them and get into that at the end of the presentations. Thank you.
Okay, I hope you can hear me now. And let's see here. Yeah, well, maybe it's good enough. Okay, so I am going to just talk about the safety net response in the pandemic. And I'll conclude a little bit with issues going forward, more permanent kind of changes, but I just have a few slides here. So I'm gonna do more talking than slides. And so let me get into this now. So let's see here. And let's see here, I need to, I think, probably go screen here. Yeah, so maybe that'll work. Okay, yeah. So how did the safety net do during the pandemic? I'll give you my answer first. I'm a professor. I always give my students a grade. How did they do? My grade here is a B to B plus. And I regard myself as kind of a tough grader. This my students tell me, at least. Moffitt, you're tough. And so, you know, some people might give it an A, and but that's my overall grade. And I'm meaning that to be a very broad brush of grade. It's not to say that it was perfect, and I'm going to talk about some problems, but a very overall sense. I'm not going to talk too much about the comparison to the Great Recession, but I'd be happy to do that during the Q&A, because there's also been quite a bit of discussion, and one of Diane's slides referred to that. But the overall, because the overall question here, we had a very severe recession, a very unusual one, I might say, and maybe I'll talk about that too, unusual relative to the other recessions, which had some effects, I think, on the performance of the safety net. But ignoring all the special features of this particular recession, I don't think it did really too bad. And I'm not going to, again, go into the details of all the bills, but I will talk about them in broad ways. If you look at the works that have done on poverty, and one of the issues here is that the data are not great yet for really making estimates of the impact of these safety net programs on poverty. We have some data, monthly data, and but we don't really have good data to do it yet. And I hope we will soon. And we could talk about data problems for a long time here, but it actually is a significant problem. But certainly all the things that have been done imply a very significant impact of poverty of the safety net programs that have been enacted during this particular downturn. But there are some issues. Okay, so let me talk about what I view as the positives first. And I'm going to lump, a bunch of legislation together here, and also there's administrative actions. They were in here all over the place, even some things at the state level. On the congressional side, we had the CARES Act in March 2020, and then the second act in December 2020, and then the American Rescue Plan in March 2021. So I put those kind of as the major congressional legislation. Of course, we have automatic responses to these programs, even without congressional legislation. And I'll come back to that. I would not say that we've been able, it is always extremely difficult to estimate how much of the increase in spending would have happened without any congressional legislation, because then you have to go to every safety net program, how much, it's a counterfactual, we don't know what would have happened with the unemployment rate going up and unemployment dropping. It's a very important question. Unfortunately, I don't think we're going to have the answer. My seat of the pants answer is a very large fraction of this was Congress and federal money, and not so much state money, and even federal automatic very, very tough to really say that, how much that is. A lot of these programs would have responded without congressional legislation, and a lot of money would have flowed out automatically. In fact, that's why a lot of them are called automatic stabilizers in the macro literature in particular. Anyway, what are the positives? I regard the unemployment insurance legislation in the CARES Act as being pretty generous, and I think much more generous in many features than in the Great Recession. Not in the number of weeks made eligible, but in the supplement of benefits and in the coverage of additional individuals, which Diane alluded to parenthetically there, but requiring the coverage of part-time workers and the expansion to contract workers and independent contractors like gig workers and people like that, and self-employed workers. I'll talk about a little bit maybe, at the end when we get to what now, do we want to continue covering those people, which I think is a tougher question, but important one. The economic incentive payments, there's a typo there. I think maybe a Freudian slip, economic impact payments. And but that was very important. Diane showed the dollar magnitudes of those. That's pretty unique. There was a tax cut in the Great Recession, but nothing quite like this occurred back then. Very important. And then if you look at the caseloads, and Diane showed some spending numbers there, Medicaid SNAP responded dramatically. One of the reasons I think they responded so dramatically was that the asset tests of those programs have been greatly reduced over the past couple of decades. And the Affordable Care Act, I believe people may be more knowledgeable than I, but I believe the Affordable Care Act basically got rid of asset tests in Medicaid. Why that's important in a recession? Because a lot of people lose their jobs, have significant assets. And if you have a SNAP asset limit of like $2,500, a lot of lower middle class and blue collar workers, they have at least that much in the bank and they wouldn't be eligible for SNAP. But most of the state SNAP, really at the state initiative, most of the asset limits in SNAP have been greatly reduced, if not eliminated, actually. And that all actually began back in the Great Recession. Well, it began before the Great Recession and accelerated during the Great Recession, when more and more states dropped a lot of their asset tests in SNAP. So I think that's one of the reasons why so many people were able to be covered and eligible for those programs when they lost their jobs. And the child tax credit, I guess I'll include that here. I don't think the Biden administration necessarily thought that as a anti-recessionary tool when they proposed it in March 2021. And I think their intent was it to be extended. That didn't happen. So right now it's looking like, anti-recessionary temporary relief plan, but it certainly was very important. I count that as a positive because it is cash for children and a non-trivial amount of money. You got to remember, a lot of the poor, especially the very poor, are not covered by UI. They do not have the earnings and employment history to be eligible for UI. And therefore, they had no cash other than the economic impact payments. And Medicaid and SNAP are great, but sometimes you need to pay the rent and you need to do some other things. You need a little bit of cash. And child tax credit, at least for families with children, provided that cash during this very significant downturn. Okay, so what about the negatives? My view is the UI expansions that were enacted in CARES, and even to some extent those in the December 2020 and March 2020 legislation, were not very well designed. They did not properly increase payments in a reasonable way to people with different levels of earnings. They indiscriminately extended weeks, no matter what the state had already. It was only temporarily expanded, and then it expired, and at different rates in different states over the summer of 2020 and the fall of 2020, and then December it came back, more were added. I review it as very inefficient. Okay. And when I talk to different people, some people aren't bothered by that at all. Who cares? We got all this money out there. Money was needed. Maybe some people got more than they should have, but who cares? I'm an economist. I believe things are better if they're well designed. And so I think it would have been nicer if we'd done a better job than that. SNAP benefits were not really increased all that much until the December 2020, and then increased kind of for other reasons in 2021 when the administration increased the value of the so-called thrifty food plan. But the caseload went up because so many people were eligible. But that's unlike, by the way, the Great Recession, where benefits were actually increased significantly for SNAP, right from the get-go. And then finally, a really serious problem that came up was that all these payments like the EITC, CTC, and the economic impact payments, you got to get them to people. And we have no administrative system in the United States to identify the poorest of the poor people, but they're not in any database. And if you aren't working and you don't pay income taxes or state income taxes, you're not in the system. So the IRS had to go out and beat the bushes and get people to try to apply for these payments. And a lot of people did not get them because they had a very difficult time applying, and only a fraction of them got them. So actually that lowered the impact. And I view that as a problem with our system. And I'm going to say, I hope we can address that one after the recession. Okay, so the last slide. What about the future? Like all recessions, everything's ending. Okay, it's going out, and not everything is going. Well, that Aparna asked that question. Actually, back in the Great Recession, a couple of things were made permanent too after the so-called temporary expansions during the Congress provided them. To me, a lot of the inefficiency in the response to the UI could be eliminated if simply you have an automatic system in which triggers were activated in different states and different areas. When unemployment raised a bunch of level, and federal money automatically went out. And that's the reason why the CARES Act was so poorly designed, because they were in a hurry. They didn't have time to design a good system. They were in a huge rush. The unemployment rate jumped up to 14% within 2 months, and they had to move. So they just passed something very quickly. If we had something in place in advance, that would be much better treated. And we can talk about the politics of that maybe later, why we don't have that already. Why don't we set up an administrative system where we can actually get money to people who aren't in the tax system or not even in the Social Security system if they don't work? How can we identify them, and so that next time we can get money to those people much more easily? And now that we return back to where we were before, Aparna said, where are we? Well, we've got problems. We've seen problems we had before. I view the UI system as really problematic in our country. State financed, which creates incredible inequities across states. They're all raising tax rates. They're all cut. And right now, if you look at the data, a lot of states have been cutting back on their UI systems. Fewer and fewer people take up UI who were eligible. A lot of states are cutting back the weeks of benefits, and they're tightening up the eligibility conditions as far as what earnings and employment you need. They're retrenching because they don't want to pay for it, and they don't want to raise the taxes. It's just a really bad system. I think we need to think about requiring part-time coverage. We got to think about independent contractors, although it's a very difficult problem to just say, if you're a gig worker, like when do you become employed? When your earnings drop? How to classify eligibility there is a difficult problem, but needs some thought. I have some ideas on that. Cash, the very poorest of the poor are not eligible for UI, and so you can get Medicaid and SNAP. Those are the two big ones you can get if you aren't working in the United States. But you can't pay the rent with either one of those, and you can't use Medicaid, to eat. So you need a little bit of cash, and how to do that. I don't propose bringing TANF back, but I think some temporary cash subsidies or some other designs might at least alleviate that, or maybe the child tax credit. But something, I think, some cash needs to be gotten to the very poorest of the poor. And then nobody's talked about housing. I think our housing programs are really bad. Only a fraction of the people who are eligible get assistance from our subsidized housing programs, either public housing or Section 8 vouchers. And affordable housing is a serious problem. And these problems all come back to haunt you during the recession. And then the recession's over and say, okay, well, now let's do something about it. But anyway, I hope we do this time, even though we haven't maybe so much in the past. So I'll stop there and turn it back over to Aparna.
Thank you, Robert. Amazing. Turning over to Jason, and then we'll come back, and I have lots of questions already. Thanks.
Great. Thanks so much for letting me join this group. And I agree with almost everything Diane and Robert said. So some of what I'm going to do is restate it, but restate it without slides, for better or for worse. I'm going to make /explore 5 big issues. The first is that the big picture story here is a very successful response. This could have been an absolute economic tragedy compounding the human tragedy and the medical tragedy that we experienced, and it wasn't. That's true in terms of the macroeconomy, the V-shaped recovery, the lack of a financial crisis, the lack of bank failures, the lack of credit strains. It's not our topic today. And it's true in terms of the impact on people. Poverty going down in 2020 is remarkable. Going down more for example, Black and Hispanic people than the overall population is remarkable. The hit to market incomes was very regressive and hit the most vulnerable the hardest. The support was the most important for those who were most vulnerable and was very progressive. The net impact was after tax and transfer income inequality almost certainly fell in 2020, stayed low in 2021. Poverty fell dramatically in 2020, probably fell somewhat more in 2021 as well. And this sends a real lesson that some of the suffering that happens in every recession with poverty rates up and income down reflects a choice. We actually did an okay job of this in the Obama administration. The stimulus wasn't as large as I wanted, wasn't as large as it should have been. But if you look at the supplemental measure of poverty, it actually didn't go up very much in 2009, even though the unemployment rate went to 10%. Deep poverty didn't go up at all. And so we created some degree of a wedge between just the absolutely terrible thing happening in the economy and what happened for families. Here, that wedge was a much, much larger wedge. And that shows that this is really a choice. Notably in 2008 and 9, and this time it wasn't the pre-existing social safety net that did that. It was a legislated expansion to it, which is what I'll come back to. So that's the first point. We shouldn't lose sight of what was very successful. Second, that we shouldn't overly generalize from this experience. These programs, in some cases, were set up in a hurry. In some cases, the objectives were different. In 2020, the goal was not to get people back to work quickly. The goal was to enable people to not work if they didn't have to, because from a public health perspective, we were trying to put the economy in a medically induced coma. We were not trying to maximize GDP in April of 2020. Quite the contrary, we were trying to keep people from suffering, but also enable them to make choices like not working. So some things like labor incentives were different. Certainly in April and May 2020, I would argue up until widespread vaccination by April of 2021, that our objective function should be different than it would be in a normal recession, when we'd love anyone who can find a job to work. And I think that probably should have been more in the objective function after April. Also, a lot of these were temporary programs that were stood up in a hurry. We've mostly talked about the ones that built on the existing programs like unemployment insurance and SNAP. There were also things like a paid leave program that was set up in legislation even before the CARES Act that ended up basically spending nothing and helping no one. And I might have exaggerated, but if I exaggerated, it's by a couple dozen people. So let's figure out what lessons we can learn, but also what we can't. The third is there's a set of targeting and efficiency issues that are more technocratic and less political, and there's no reason not to do better next time. For example, there is a really big debate about how to balance, moral hazard associated with more generous unemployment insurance from consumption smoothing associated with more generous insurance. And you can argue all sorts of ways about the right way to do that. There is no one that could come up with an explanation that could rationalize why the weekly bonus was $600 through July, then it was $300 for a few months, then it was $0, then it was $300 again, and then it was $0 again. And it just went up and down and up and down. So, maybe I don't think the 600 was too high, given the objective wasn't to encourage work. For the moment, it was. I think 0 was certainly too low for November and December of 2020 when we were still in the thick of the pandemic, had very high unemployment rate and there's no supplement. I also think $300 was too high in June of 2021 when jobs were improving rapidly, job openings were very high, and the pandemic was easing. At the very least, I would say the correct number for January 2021 for unemployment insurance was not the same as the correct number for July of 2021, and yet we had the same support in both of them. A second thing that should not be controversial, and Robert and Diane to various degrees touched on this, is just a lot of people falling through the cracks, people eligible for economic impact payments who didn't receive them, people who had a difficulty signing up for unemployment insurance, people who fell through the eligibility rules on all of these. And so getting better electronic interchanges between people and the government, better ways to reach people, better ways to pay people automatically, better ways to deal with financial inclusion. And all that's gotten a bit better over time. It's probably better this time than it was in the past, but with millions of people left out, it's not good enough. Unfortunately, and so some of those non-controversial issues, by the way, and this gets to reinforcing what Robert says things like automatic stabilizers. My experience after the financial crisis and the Great Recession was that we ended assistance too soon. Long-term unemployment was very high when we ended unemployment, extended unemployment insurance. Poverty was still high when SNAP went away. State fiscal relief ended when states still had big fiscal problems. And so I had in my head this Congress hires of assistance too soon. In this experience, in some ways we did too much, or not in some ways, in a lot of ways in 2021. The unemployment insurance just should not have been that generous in June, July, and August, for example. And so the automatic stabilizers is actually a little bit more of a symmetric argument than I used to think. Oh, and state and local relief, an even clearer example of that. Way too much in 2021. I don't think there's anyone that defends that as anything other than a pretty sizable waste of money. So, automatic stabilizers, I used to think, prevent you from premature cuts. I think it also, this time, if we'd had it, for example, for state and local fiscal relief, we wouldn't have had all the extra unnecessary assistance in 2021 either. So sometimes it'll mean you spend more. Sometimes it'll mean you spend less. I'm not sure on balance if it overall is going to be more or less spending, but what I am sure is it will be spending that's better timed. One thing about automatic stabilizers, if we pass them, Congress would still pass laws. Wouldn't be the end of laws. So you want to think of them not as the thing you do and then you never make another change. You want to think of them as setting a default, and setting a default that's less stupid than the default of current law. My fourth point is that maybe automatic stabilizers can be more technocratic, especially now that we know they're two-sided and they can mean more spending and mean less spending. Maybe the targeting is technocratic. But my fourth point is that there's a lot of issues that do entail political trade-offs. A lot of people that were left out because of their immigration status. That wasn't a technocratic accident. That reflected the values and choices of and compromises that went into the legislation. I have a very, very different set of values and choices that I would have made based on people's immigration status, which would have been to include them in the payments. There's also an even bigger question of how much do you want to give to the middle class, to the upper middle class. That again wasn't sort of they weren't listening to economic experts, and it wasn't about economic analysis. It was about political choices. And just to put some context on this, there was $5 trillion spent on relief. About half of that basically went to households, pretty much directly or indirectly through PPP, so about $2.5 trillion. The poverty gap in a normal year is about $170 billion. So with well-targeted, well-designed money, it would be impossible to get it exactly right because of moral hazard, et cetera. If you promise someone you give them enough to get out of poverty, they might not work to get out of poverty. But in theory, if you could spend $170 billion a year to eliminate poverty, and would have been more in 2020 and 2021 because incomes fell. I don't know how much more. Let's say it was $300 billion. And we spent 15 times that and cut poverty in half. So the money could have been spent much, much more efficiently. But again, that's not the sort of lack of technocratic advice. That reflected a choice about who to give benefits to, not necessarily the choice that I would have made. Finally, I want to put a fifth issue on the table. You look at the United States compared to other advanced economies, our GDP recovery has been much better than any other advanced economy, at least any other major advanced economy. We're only a tiny bit below CBO's pre-pandemic forecast as of Q4. Most other countries are 2 to 4% of GDP below their pre-pandemic forecast. But the employment forecast and the employment recovery in the United States has been much worse. And the United States remains well below even the level of its employment in February 2020, let alone the employment rate we had in 2020. Mostly that reflects a large withdrawal of the labor force. Now, it's tempting to say that's because of COVID and because of long COVID, because of the psychological fallout of COVID, because of the disruption COVID has had on households and caregiving. But you don't see that employment decline in most of the other advanced economies. In fact, the United States has by far the largest employment decline of any of the major advanced economies. They had a lot of COVID too. Understanding why we did well in terms of GDP, but did badly in terms of employment, to me is incredibly important. Some of it may be pre-existing institutions that may not be copyable. Some of it may reflect policy choices, possibly the employment retention system that Europe and others had, rather than unemployment insurance, worked better than us. Possibly what worked better was it gave employers leverage to force employees back to work when things got a little bit safer and business resumed. In the United States, employers couldn't force workers back to work. The replacement rates and cash support was much lower in Europe than the United States. I don't know the answer to this, but to me, this is perhaps the most important question to understand, which is how in the next recession, we can get more jobs per unit of GDP, which is to say we want to protect GDP as much as we can. Even more important is protecting employment. And we haven't done a very good job of that. So I'll just summarize on number one, big picture is a very successful response. Number two, you don't want to overgeneralize because there's some things that were quite different. Number three, there's a bunch of technocratic issues around automatic stabilizers and better reaching people that we should all be able to agree on. Number four, there are a set of tougher issues that involve political trade-offs, especially around payoffs to the upper middle class and lack of payoffs to people based on immigration status. And five, anyone who can help me understand why the employment recovery has been weaker in the United States, and are there any policy remedies to that? That to me is the question I'm most interested in learning the answer to.
Thank you, Jason. This was very interesting listening to all of you. I know Jason said that he basically agrees with Diane and Robert, but it sounds to me like when I listen to you, Jason, that you're saying that this was a successful relief program, and Diane and Robert seem to be saying, well, it could have been better if it had been made more targeted. It could have been more effective. It didn't really reach the most vulnerable. I think I got some of that from your discussions as well, Jason, that it didn't, the money didn't reach always the people who needed it the most, the households that needed it the most. If I had to ask all three of you to sort of reflect on lessons learned from the pandemic, and you can go back to the Great Recession, because I remember, like you said, Jason, we don't know where that 600 number came from, right? Why did we decide to expand unemployment insurance by $600 per week? When during the Great Recession, all we did was expand it, I think it was $50 per week, right? Where did this come from? And what are the lessons? Heaven forbid we have another crisis, 5 years down the line, 10 years down the line. What lessons have we learned from the COVID-19 response? And before you get into that, it's also interesting to me that when you look at the most effective programs that helped get people out of poverty, it was cash. It was cash-based payments, right? Like it was the economic impact payments, the expansion of UI. So is that a learning from the COVID-19 pandemic that the best way to provide relief to families in crisis is to hand out checks, is to give direct cash transfers, and to reduce our reliance in some ways on the traditional safety net, on SNAP, on how, if you had to weigh the two, which piece of the response was the most targeted, the most effective in your perspective? So I can start with Jason since you were already speaking.
I think, like so many aspects of both the micro and the macro, to some degree, we overlearned the lessons of the Great Recession. We did too little then. We did too much now. We're suffering from that in terms of inflation now. And, I think, though, I'd sort of maybe rather make this mistake than the one we made last time, but we're not going to be able to spend $5 trillion every time we have a problem that hits our economy, and we're not going to have the will to do it absent something like this. So I think we really do need to be much, much harder about how to be more targeted on this. On the $600 for UI, the idea was to get the replacement rate to be 100%, but that number was in excess of what you need to do to even accomplish that. In April of last year, in April of 2 years ago, that doesn't bother me that much. If you were discouraging people from working, that might be more of a plus than a minus. But for any normal recession, that's not necessary. And by the way, it overshoots the consumption smoothing. You look at people who got unemployment insurance, they end up spending more than people who kept their jobs. And so you don't actually want a system that makes you better off if you lose your job than if you didn't lose your job. So even if there was zero moral hazard at all, you'd rather sort of have done $300 plus then extra money for everyone rather than $600 for one group and nothing for the other.
Robert?
Yeah, so, well, the on lessons learned, I think kind of overlap with what Jason said. Like I said, I gave it a pretty good mark. So if we had exactly the same kind of recession again, and we did exactly the same thing, I'd be okay with that, and not be horribly depressed. But as I said, I just think we could have done better. I will say this: a very unusual recession, and let's hope we don't have another one that is induced by a very sudden onset of a health crisis. If you look at the Great Recession, the unemployment rate went up really slowly, over a period of a year, really, or maybe even 18 months before it peaked. Congress wasn't in quite as big of a hurry in passing legislation. This time they were in a very big hurry. I actually think having something automatic would be better when it's sudden like that. You're less likely to kind of make it. Back in the Great Recession, they didn't actually add $600 to anybody. They mainly extended the weeks of unemployment.
Right.
So you could keep receiving benefits for a lot longer. Although they have the same problem, Jason can, when to cut it off? And, some states are triggering off here, some states are triggering off there, very confused. And even aside from maybe ending it too early, it was just kind of, what are unemployed workers supposed to think, they don't know what's going to happen. As for these automatic stabilizers, I think a lot of our problems, I think come from deeper problems. And the deeper problem is that we have a state-based UI system. And that goes back to the 1930s when it was originated. And the guy who had the idea, this guy, John R. Collins, an economist at the University of Wisconsin, said, hey, Congress in the 1930s, they're never going to do this. They're never going to pass. Let's just have a state system where you get the firms to pay, and then the money goes out to UI. Make it all a state, and everybody will be happy, and pretty soon all the state legislatures are passing it. But when you have a system like that and all the rules are different, having Congress come in and say, okay, now we're going to have this set of triggers. Some states get more money than other money. You know, the states have been really ungenerous with their plans. They're probably going to get more money. You know, states that have had high taxes and paying, they're not going to get as much money. You get on to all these complications. That's my explanation for why it hasn't happened, because what happens is every recession, the Congress says, hey, why don't we have an automatic system? We don't have time to think about that right now. So then later, oh, well, you know, let's not, we're out of it, forget. It's too complicated politically, you know. So anyway, as for cash versus in kind, yeah, I want to throw out a question for Jason, okay? So why didn't we cut the payroll tax rate in the pandemic recession like we did during the Great Recession, which obviously gets some cash, people who can work at least, that's who it's aimed toward. Why do we do that this time? So that would have been a cash. I've always thought, as I said in my remarks, that you need some cash. There's a balance there, some in kind and some cash. But during recessions, you need some cash there for people for a broad range of expenses and not just the ones that are supported by in-kind transfer programs. So I'll stop there.
Okay, thank you, Robert. Dan?
Thanks. I only have a little to add. I certainly learned a lot. This was definitely a very different recession than we've seen otherwise. But I want to make a couple of points. One is I didn't get a chance to mention how great it was that they stood up a brand new program, the pandemic EBT payments for children who lost access to school meals during the pandemic. In many places, that money went out quickly, and it has proven to be, it's reduced food hardship. I also would say it really highlighted the important role of our schools in delivering social services like meals, like healthcare in some places. And to me, one of the big takeaways from this is that we kept our schools closed too long in the United States. We are it's going to take a lot to dig out of the mess that this has caused. We're seeing a lot of mental health problems in children. Certainly, they've estimated the lost learning is going to cost the economy something on the order of $1 trillion. On top of the payments that we've already made. In setting up whatever next time looks like, I do think, hopefully we won't face another pandemic like this, for another 100 years. But we need to, I guess, be prioritizing our investments in kids, and at this point, really trying to make up for the damage that we did that other nations didn't do. Other places were able to successfully keep their schools open more, and the children have suffered much less in those other places. Great.
Thank you so much. Yeah, one final question before I turn to the audience. So just a reminder, please put your questions in the Q&A chat box at the bottom of your Zoom screen. Before I turn to the audience, one quick question, and I want to start with you, Diane, or Robert, whoever wants to take it. We also know that prior to the pandemic, usage of the existing safety net was very low, right? And Robert, you mentioned that for unemployment insurance, like so many people who are really poor and vulnerable are not able to access the UI system. And Dan, I think when you look at SNAP data, some of that comes up as well, that maybe people who should be accessing the safety net are not able to do it. Why is that true? I think you mentioned TANF, Dan, that TANF does very little today. Like cash welfare is literally gone from our economy. So what are the reasons behind that, and how do we fix that? And what are the ideas for fixing that going forward? Because when we look at the COVID response, again, as I said, it seems to me, you look at the Census Bureau report on what really lifted families out of poverty. Well, it was the cash payments, it was, CTC or the UI expansions that were literally cash. But in the pre-pandemic safety net, usage rates are really low. So what explains that, and what are your ideas for fixing, those issues?
Yeah, great question. So I think it's helpful to distinguish between usage rates conditional on being eligible, and then also how we've designed the programs. Right. Who's eligible, et cetera. Who's eligible for more or fewer benefits. So I'd say on the participation among those eligible, I think I've got a slightly different perspective than that. I think participation rates in SNAP overall has been steadily increasing. I think we're up to something like 85% of people who are eligible for SNAP take up SNAP. Now, of course, there's substantial heterogeneity across groups in that. So the elderly are less likely to participate in SNAP, conditional on being eligible. And there's good evidence that, grandma and grandpa's earnings don't change very much. Their incomes are very stable, and we could probably stand to make them re-up for SNAP less often. There's good evidence that works, and it doesn't lead to overpayment for the elderly, in any sort of substantial manner. Of course, the other group that we've seen take a real hit in its participation in recent years has been immigrants, and also, as Jason mentioned before, that was a political choice, and as a result, we left lots of children in those families at increased risk. So, I think that for the overall, we're in a situation where there's a lot of good to be said about the social safety net, but the caution is we have designed it in a way that we want to prop up earnings, we want to reward work, and there's a lot of value in that. But there's also a downside, and that downside is really revealed when there's job loss. Robert, I'd love to hear if you agree or disagree.
Okay, well, let me just say, I think the biggest safety net program that needs major overhaul is our subsidized housing programs, because I think that SNAP is doing a pretty good job, and I think Diane is the expert, but I think we have pretty high participation rates of eligibles in SNAP. Medicaid also has pretty high participation rates. I do wish the non-expansion states and Medicaid were to cover childless individuals, because I think really everybody should have access to affordable affordable health care. I put that really basic health care, food, and housing. And on housing, our problem is that we have a very limited number of vouchers and public housing units. It's constrained by Congress. It is not an entitlement program. The fraction of income eligibles who are actually getting a unit is like 30% or something. So you've got 70% of the people who are eligible for help. And remember, they have to pay rent. It's not a freebie. You have to pay rent, but you get a subsidized rent. And especially if you live on the West Coast or the East Coast, you desperately need that. Waiting lists for housing, units are 3, 4, 5 years long. Now, what's the solution? To spend more money and cover everybody? Maybe, I don't know. But you can also imagine, I know a lot of people would prefer to be a little bit less generous on the subsidy rate and be able to cover more people with the same amount of money, or some combination of that and more money. As for cash, I'm actually not a big fan of bringing TANF back. TANF has so many problems, restricted to single, not entirely, but focused mostly on single parents only, not for childless. If you were married, a couple, much harder to get payments. All of these kind of weird rules in TANF, I just don't see it, to be honest. But TANF had one thing in 1996 that I liked, and that was that they had this idea of emergency payments. Okay, didn't really work very well. Because they ran out of money, and then they don't have any money. But the idea that somebody walks in the door, hey, I can't pay the rent for the next 2 months. Okay, give them a check to pay the rent. Assuming they're low income and satisfy a lot of conditions, give them a check to pay the rent for the 2 months. Or I just had automobile breakdown, and I just can't get to work. In the next month, and you're a low-income person, who's disadvantaged. Hey, give them a few bucks. So I think we need more than that, but that would be a start, and that has been talked about in White Houses before. But it would at least be something to get started on.
Great, Jason.
I don't really have anything to add to the answers we just heard. I mean, Robert a while ago asked about the payroll tax. I would just say originally we did something called Making Work Pay. That was, I believe it was $400 for single, $800 for a married couple, and it phased out at about 100, 150. We wanted to continue that after it expired in 2010. The Republicans wouldn't let us, and so we switched over to a payroll tax. Payroll tax is less well targeted because it gives the maximum amount only if you make 100, well, I guess 130, 40, I don't know what the cap is now, something like that. Because the maximum amount if you have very high income. And so it's much less well targeted. We agreed to it as a compromise because it was important to them that taxes were being reduced rather than just people getting a check. Of course, to economists, these are all taxes and transfers, and that's a little bit of an arbitrary distinction. So I wouldn't try to revive payroll tax cuts. If you want to revive anything, I'd revive some flat cash payment that phases out above a certain income, and the income being lower than where it did this time.
Great. Okay, I'm going to turn over to James if he's still here. I know he had class. James, are you still here to do the Q&A? Okay. Let me just start. I see some questions in the Q&A that we can get started on. Ted Truman, who's also a senior fellow here at HKS, says, have we learned from past crises, for example, the Great Recession, and what does that imply for learning from this one? So it's kind of the reverse of, I think, what we just discussed, which is what are the learnings from this recession and what does that mean for future policy? What did we learn from the Great Recession? Jason, I'll turn to you first. That you thought got applied in this recession or didn't get applied or should be applied in future crises?
Yeah, I mean, to some degree, I addressed this, I think, probably after Ted wrote it. But, I think we went large this time instead of small, and partly that was a lesson, partly this was just an unambiguously huge event that was happening. I think an emphasis on using a variety of different social safety net programs to get to people was another one that was taken from there. And, then we learned not to worry about inflation in designing these programs. And that obviously was a bad thing to have learned.
Robert and Dan, any thoughts on?
I kind of agree with Jason, on these things. Like I said, I thought we did pretty well. I will say that during this recession, the disproportionate UI, fraction of the relief is different than the Great Recession, and I don't have any problem with that. But it was a difference. So there was, if you look back, there was more money spread to other programs during the Great Recession than now. I like the economic impact payments. I think that was a lesson we learned, this time that we didn't quite have to the same degree. I thought that was good. And I actually wish there'd been more of them than we had, at least a little bit more. We had less time. So of course, I've already mentioned the lags, but that's a bad lesson. I want to throw in one plug that we learned that UI computer systems are completely out of date. There were, computers in the 1970s, and they just couldn't handle it. Among the many problems UI, that one was law. Why can't we fix that one? Anyway.
I remember sitting at CA and we would call the state agency. They were like, why can't you just change the replacement rate? And it's not, they were like, we can't do any changes in the middle of a crisis. We can do
it in the middle of a crisis.
Our heads above water.
Well, the problem is states don't want to pay for it, okay? And
that's the bigger thing, exactly.
So why can't the Congress say, okay, we're going to subsidize you, okay? Well, we'll pay 50% of modernizing your intake system, into UI. Anyway, I think there were several lessons learned here from the comparison to the Great Recession. Diane, do you have anything?
Yeah, I was going to agree with that and call out Florida as a case study. So we got a lot, I think a lot of us have read articles about they had real trouble with their unemployment insurance system, which is run by a different part of the government, as I understand it, than their SNAP. Let me tell you about SNAP in Florida and Texas. It's a really effective program for dealing with disasters and displacements due to hurricanes. And so states like Florida and Texas have made smart investments in making sure that they can remotely pay out SNAP benefits. They can pick up and move the headquarters from a place that's hit by a headquarters or by a hurricane to something else. Mm-hmm. And it was striking that these two programs in the same state of Florida, unemployment insurance wasn't particularly effective, whereas SNAP, they were quick to respond, et cetera. And I think that really highlights the importance of just boring broccoli, working on making sure that administrative systems are appropriate.
Okay. Mm-hmm. Great. Second question is, why didn't they just use SNAP cash accounts? Those with no bank accounts and those who do not pay taxes still frequently receive SNAP and have an EBT card. They use this at a state level to give $1 to LEHEAP recipients to track them. I don't know who wants to take that. Dan? I'm going to turn to you.
And that is a technical question that I'm going to punt back to you, Aparna. I feel like you probably face things like that at the CEA. Or Jason, maybe you know better, but
Jason
don't
probably.
know the answer.
I don't remember. I mean,
I was looking for Diane or Aparna.
That's a great question, and I should know the answer. I know there was discussion of that, but there was some technical reason why. But I should be quick to say that.
Doesn't everybody not have a bank account? Wasn't that the big issue with the EIP payments as well? So I don't know how they deal with it in SNAP.
Well, I can say that the pandemic EBT payments were pushed out much more quickly to people that already had SNAP cards. That's not the same as cash, but it did build on that existing infrastructure. And probably a good lesson learned from this is that we should have more infrastructure for paying out cash payments quickly in times of emergency.
Mm-hmm. Another one, how would senior disabled usage of SNAP change if more states allowed for pre-prepared, hot and/or delivered meals? Many prefer to go to senior centers, Meal on Wheels, or fast food drive-through, which are not covered by SNAP and/or don't have easy access to grocery delivery.
Oh, that's a great question. We have sort of a problem when it comes to the elderly. Of course, we know that more and more are becoming elderly and they need more help with activities of daily living. And it does seem to me that one of the big frontiers is trying to figure out how to get healthy prepared meals to elderly folks who can't. I think we're just going to see more and more of it. I know here in Chicago that our food bank is spending a lot of resources on trying to crack that nut and figure out how to fill this part of the market. Now, I do think that there are government opportunities to support that kind of work. I don't know sort of what it would take in SNAP, but without question, it's just a first order problem facing many members of of the elderly community, and we need to be working on it, and we are.
Great. Robert or Jason, do you want to add to that?
It's also in the category of things I always rely on Diane. That's Diane's ballpark. So I would never, correct or add to anything Diane says on that subject.
Let's talk a little bit about the Ctc expansion. I know we haven't had a chance to get too much into, what are we likely to see there? Is that there's a lot of debate about whether the Ctc expansion during 2021 should be extended as permanent policy. I'm just curious, how all three of you feel about that. Is that good? Would that be good? Would that be a bad thing? I know it's politically charged, and I know it's probably, not going to happen anytime soon, but just curious if your views on that.
I'm happy to start.
Oh.
It's probably no secret that I think the child tax credit, as was implemented the second half of last year, was good policy. I thought it was well designed in terms of it being more generous to the youngest children, where there's good evidence that making sure that they're insulated from economic deprivation is extremely important for brain development. I think that the idea of monthly payments to help families make ends meet makes a lot of sense. Now, of course, there are incentive issues that we have to consider. Mm-hmm. Traditionally, the child tax credit has not gone to families without earnings, right? So, if you think about it as a graph, there's no y-intercept. People with zero earnings get zero child tax credit, and then that ramps up, kind of like the earned income tax credit, but at a different rate. And so for me, that raises a couple of questions. One is, do we really think that that's optimal? Do we want to be providing no resources to, or less than full resources to, I think it's 30% of children weren't receiving the full child tax credit prior to this because either their families had no earnings or too little earnings. So that's one, but then of course we have to balance it with, are there incentive effects, or how big are the incentive effects? Of course, we know which the direction would be by providing any out of work payments, but is that large? Is it meaningful? And I think the read of the evidence is that it was likely to be relatively small work disincentive impact. And I think that was going to be more than outweighed by the positive impacts. Nobody's got a crystal ball. So if we are in a position where we can expand the child tax credit, I think that's the main thing that we're going to have to keep our eyes on.
So if we could continue the child tax credit, that would be great. One thing I like is that I always get nervous about, I think a really well-designed investment program could have a higher return, but it could also have a lower return. So for example, if you do state matching, some states will do it, but some states won't. Or maybe the program administrators will benefit rather than the beneficiaries. Now, I'm all in favor of that and I want to do that, but cash, I know is always going to be sort of worth $1. For anyone who receives $1, and you could do a lot worse than that with public programs. So I think there's a sort of maximizing the minimum aspect of it. But it's going to be important it's going to be necessary to prioritize. If there's a 1.75 trillion envelope, which is far and away the largest envelope that Congress could allow, and if there are no budget gimmicks and things sunsetting, you won't be able to do the whole thing. So how do you prioritize? Number one, the fully refundable part for all the reasons Diane just said. Let people get the full amount who need the money the most. Only costs $20 billion a year. Almost every dollar of that is going to reduce poverty or near poverty, not just in the short run, but also a long run investment. Second, I would take any additional dollars that you could spend after that and put it into younger children. I don't know the exact age. I'm going to throw out 0 to 3. If someone wants to correct me and add a year or subtract a year, they can. But that sort of gets you to preschool. And hopefully you have a preschool program there as well. And then the third thing is I'd add money, sort of lower down the income scale, and finally do the full thing they did. So having a sense of your tiered prioritization is going to be important because there basically were no budget constraints in the temporary program a year ago. As you set up a permanent program, there are going to be budget constraints. I think the partially refundable, not partially, the fully refundable child tax credit is far and away the most important, obvious no-brainer we could do about poverty in our country.
Robert,
okay.
did you?
Yeah, sure. So child tax credit. Well, yeah, I'm on board and in favor of it. I do, being a guy who likes to concentrate payments on low-income families, I would like to see it concentrated on low-income families and not go too high up in the income distribution. I'm sorry, that saves bucks and it concentrates it on the people who need it the most. The work disincentives are there, and there's no question, I'm an economist, there are work disincentives are there. some of the estimates that have been made, I think, are wildly off base. And at one of these forums where I was asked to speak on that and review all the available studies, you know, I came up with a range of like 200 to 400,000 people quitting because of it. That's not a big number for the poverty reduction you get from it. And the final thing I want to say about it is that child tax credit, you know, okay, you got to understand that most of these labor supply reductions are from women who want to spend more time with their children. And the only reason they're working, because they have no money if they don't work. They have Medicaid and food stamps and nothing else, and they can't pay the rent. And they're working and they don't want to. They want to spend more time with their kids. So I'm in favor of keeping, you know, work incentives there. By the way, the work incentives are up to minus 40%. The tax rate is minus 40% right now. Yeah. That new child tax credit would reduce it to minus 30%. I mean, you know, so come on. And if you're worried about that 10%, hey, increase the child care subsidies and get that return to work back to minus 40% if that really matters to you. So I always think you should do combinations of things. If you decrease work incentives here, increase them with some other program so that you still have those work incentives there. But I'm really not bothered by some mothers wanting to spend more time with their kids and not feel like they have to work.
Great. I think there's just one quick, Jason, if you want to respond to this. Is there a way to make the income tax design better as an automatic stabilizer in the face of a severe recession? Is there a policy change that would somehow be acceptable by both political parties? I don't know if that's about payroll tax design, or we can twist it any way we want.
I think there's two types of automatic stabilizers. One I call technocratic automatic stabilizers. The Medicaid match rate is higher in a recession and it's lower not in a recession. UI is more generous in a recession, is less generous not in a recession. And you could design those to have actually the same average spending as now, or higher expected spending or lower expected spending, but there's sort of a technocratic aspect. There's then a second thing, which is basically any time you make the government larger, and anytime you make the tax and transfer system more progressive, you are improving the automatic stabilizers. The Affordable Care Act was an enormous improvement in the automatic stabilizers. It will actually help with macroeconomic stability going forward. Needless to say, that wasn't the main argument that we made for it. In fact, it isn't the main argument benefit of it. And, you know, I sort of disagree with people that don't like the Affordable Care Act, but I wouldn't say anyone should change their mind because of the point I just made on automatic stabilizers. So that is an aspect of automatic stabilizers that gets bound up with values and beliefs about the size of government and the degree of progressivity. In terms of the income tax, I mean, I could imagine some sort of contingency of when the unemployment rate went up, such and such went down, but that's a little bit clunky and the timing would be strange. No, personally, I'd rather make it a better automatic stabilizer by having higher taxes on high-income people and lower taxes on low-income people and send checks to very low-income people. And that would make it a better automatic stabilizer. But I admit that would also, you know, I like that even more just for my values on progressivity and the role of government, with the automatic stabilizer being a bonus.
I'm not really a big fan of using the income tax system, to be honest. I mean, unless you work with withholding, you know, it's an annual time frame for most people. And I don't think that most people anticipate, you know, their taxes and start altering. I mean, Jason may disagree with me. There's a ton of macro research on impact of, you know, temporary tax cuts and stuff like that. I just think Jason used the word clumsy. I think it's clumsy. And it's not easy, and certainly in this pandemic, where the unemployment rate went to 14% in 2 months. I mean, how are you going to adjust the income tax rate schedule or you know, credits or something to deal with that? You know, it just doesn't seem like the best tool.
Dan, anything?
Nothing to add. Yeah.
Okay, great. Yeah. Well, I just wanted to give everybody an opportunity for any final thoughts before we wrap up. I know it's late here on the East Coast, and I know Jason has another event right after. So let's turn to you, Dan, first, and any final concluding thoughts on what we've learned from the pandemic safety net response, what can we apply going forward?
Yeah, I think that I agree with the other panelists that we did a good job, especially in the midst of an emergency. That said, a lot of it wasn't quite as targeted as I would have preferred it, and so I, continue to think it's a good idea for us to think about investments, especially in some of these technocratic solutions, so that next time we face, heaven only knows what kind of a recession we face next time, but we'll at least have the tools at our disposal to be able to tweak the replacement rate, or to pay out some cash on those SNAP cards, or whatever it looks like.
Great. Jason?
Yeah, I just think you, like so many things, you need to keep two ideas in your head. Something very good happened. Something could be better next time, and not everything that was good about this time is applicable to the next time. I think it helps to separate out and understand some things in some sense were a mistake that could be solved by better technocrats, and other things are, sort of bigger, more fundamental argument, and want to make that set of arguments too. And in general, I'm not that worried about the budget deficit. I'm not that worried about the debt, but there's no way we are going to, no way we ought to spend $5 trillion every 6 years on a new emergency. And so prioritizing and getting it better is going to matter a lot. And I think the good news is we could have spent a lot less and still got a very good outcome. So it's a very doable thing if we do it right.
Great. Robert, you get the last word.
Okay. Well, I'm in agreement with Diane and Jason. And I will say that when you're planning on the next one, wear some wood to knock on, but, I hope we don't have a public health crisis like this one again. We're going to have another recession. We haven't gotten rid of the business cycle yet, I'm sorry to say. But I hope more of them are like, the 2000-2001 recession, or the early 1990s, or even Great Recession, which was gradual and we had a chance to deal with it. I'd like to see some kind of less generosity, than we had this one, but more than we did in the Great Recession, if we have another Great Recession again, and a more kind of normal shaped recession, So I think there's some lessons there, and but I'm just very happy we're out of this one. We're some more wood to knock on, but then we're moving forward. If I had one item, just a broken record here, the UI system is broken, needs fixing, and I hope we make some progress on that. Anyway, Aparna, thank you for inviting us all to speak. It's really been great, and enjoyed the questions from the audience too.
Thank you so much to all of you. This has been a great discussion. I know I've learned a lot. I'm sure the audience has, and we've had tremendous participation. We're going to continue sort of this discovery of, what happened during the pandemic, what lessons have we learned from that, and I hope people will continue to join and ask these interesting questions. So thank you so much, Jason, Robert, Diane, for your expert comments, and thanks to all of you for joining. And I also want to thank Susan and Victoria for helping organize this. James has left, he had a class, and Dan, thank you for joining as well, and all of you for being here. Thank you so much, and look forward to the next discussion.
Thank you.